Good afternoon, everyone, and thank you for joining us today. On behalf of Proactive Wellness Care, I'd like to welcome you to today's webinar, American Heart Association's 2025 Hypertension Guidelines, Implications for Remote Patient Monitoring Programs. We are very excited to have two distinguished speakers with us. First, we have Rob Sanchez, our Chief Business Development Officer, who will be providing insights into how these guidelines will shape the future for RPM. And joining him is Tina Scot, manager of our clinical care team, who will be sharing her expertise as well. We'll have time for our Q&As at the end of the session, so please feel free to drop your questions in the chat as we go along. And with that, let's get started. Rob, over to you.
All right. Thank you very much, Mustafa. I appreciate the opportunity to speak with everybody today on this important topic. The American Heart Association, the ACC have been pillars in this arena, and there's new guidelines that came out recently, and we do want to go over the impact and some best practices that we can do for remote patient monitoring program and chronic care management monitoring programs as well. So for transparency, I want to share that I lead the company that provides RPM and CCM services to physicians, practices, and today's presentation is based solely on public information available through the AHA and ACC Hypertension Guidelines. I'll also share a slide on how RPM and CCM can support practices and applying these guidelines, but the primary purpose here today is for education, not promotion. Okay? So let's jump right in. Why this matters now. We'll look to understand the urgency and impact about these updates. We'll go over some of the highlights and major changes that every practice needs to know. Also want to have a discussion on how RPM and CCM fit perfectly into these new guidelines. And then provide some action steps, some action items for your clinic. So quick tips on how to get started in terms of applying the guidelines into a current RPM program. So diving right into why these guidelines matter now. So they matter because they reshape how we think about hypertension, not just as a number on a chart, but it's a critical modifiable risk factor where early detection and intervention can save lives. Right? They raise the bar for us clinicians, for patient care, and for healthcare systems to act sooner, act smarter, and ultimately change those outcomes. So from a financial standpoint, high blood pressure costs the U.S. healthcare system billions of dollars annually in avoidable hospitalizations, medications, and long-term care. Now, high blood pressure costs the U.S. about over $130 billion in direct expenses. For individuals, when we look at an individual basis, for Americans, it can mean thousands of dollars for them individually, and in additional medical costs over the lifetime of this condition. So early intervention, guided by these new guidelines, is just better health that can save a lot of money for both the patient and our healthcare system as a whole. Now, beyond these statistics that you see here, we know that uncontrolled high blood pressure isn't just a critical issue. It's something that weighs heavily on families as well. It causes a lot of emotional stress, knowing that they have a loved one who's at risk. These updated guidelines are really about giving families more peace of mind and giving providers better tools. So we'll talk about some of those tools available here in a second. For primary care and internal medicine offices, who we tend to work with a lot here at Proactive Wellness, the guidelines are a call to action. They mean staying updated isn't just good medicine, it's essential for delivering the best care and helping families avoid serious complications down the line. So what's new in the guidelines? The first thing is think of a set that's these are practical updates. Now we're talking, like, for instance, when we're treating stage 1 hypertension, we look to treat it earlier. It's kind of like fixing a small leak before it becomes a flood. For PCP offices, this marks a shift from reactive to proactive care, aligning this perfectly with value-based care models emphasizing on early intervention, improving population health outcomes, and providing scalable programs like RPM and CCM. The whole goal is for them to reduce the costs and drive better outcomes. So if we're able to identify them earlier and identify them and put them in a program that's going to help do something about their care, we're in a better position to have positive outcomes. Now, second is the prevent risk calculator. This is really looking at personalized care. So from a value-based model perspective, this is a strategic tool that'll help practices identify high-risk patients early. So we look to reduce adverse events by avoiding the costly hospitalizations. It'll help risk stratify the point of care. Providers can better prioritize interventions and align with quality metrics like MIPS, HEDIS, and ACO benchmarks. Now, if your clinic isn't using this yet, consider that it requires no extra technology, no extra investment, and it takes just seconds to use. There is a URL link that we can share with you so that you can go to the American Heart Association and utilize it when you have a patient there. And it can dramatically sharpen the clinical decisions and improve the patient outcomes. Keep in mind, from the patient's perspective, some may feel alarmed seeing a 10-year risk score for a heart attack or stroke. To avoid triggering anxiety, use this tool in a supportive and empowering context. Present it as a way to take control and not a scare tactic. Ideal moments to utilize this prevent calculator can be during an annual wellness visit, during a CCM or RPM onboarding, or when a patient's blood pressure crosses that stage 1 threshold. Frame it like, let's see where you're at today so we can build the right plan for you. The third component from these new guidelines is a stronger guidance on pregnancy-related hypertension. So we've got a clear guidance on managing hypertension in pregnancy, which means better care for moms-to-be. So home blood pressure monitoring is now a must-have, and that's where RPM programs shine. It makes it easy for the patients to stay engaged and for clinics to, again, hit those quality metrics. For ACOs, this supports the cost containment that they're trying to catch issues early, while fee-for-service clinics benefit from the ongoing reimbursable revenue that's available. It is a scalable way to deliver better outcomes and satisfy both the value-based perspective and the fee-for-service objectives as well. And then finally, we've got lifestyle changes that are front and center from these new guidelines, making CCM more relevant than ever. So from our CCM program, for example, it helps reinforce the behaviors between visits. It helps improve clinical outcomes, and we tie it all together back with how you can impact your HEDIS scores. So for value-based organizations, this strengthens this patient engagement, right? You've got to hit on those patient satisfaction metrics as well. We look at adjusting the risk while still generating a steady monthly revenue at the same time. So it's a bridge between saving the money and earning it without sacrificing quality. So clinical implications. So we've identified 4 clinical implications that are important for us to take a closer look at. So the first one is identifying the patients at risk earlier. So thanks to the new prevent risk calculator, we can now pinpoint patients who may look stable but are trending toward cardiovascular risk. So by layering RPM and CCM, we're not just identifying these patients, we're engaging them on monthly follow-ups, monthly monitoring on their progress at home in between visits, and then course correcting in real time, working with them, working with the provider to provide them with additional resources and course correcting as we go along. So early detection and proactive management aligns perfectly with value-based outcomes and will help meet ACO objectives and performance benchmarks. Now, Item number 2 is more aggressive intervention on stage 1. So these 2025 guidelines push for early treatment at stage 1 hypertension, not just a watchful waiting and watching, right? RPM is tailor-made for this. So monitoring for blood pressure daily, we give providers better visibility to act sooner. It also looks for whether we need to make medication adjustments, right? And escalating any lifestyle coaching, and also look to enroll patients in CCM, as they're 2 distinct services. But this gives practices a path to generate, the RPM component and then the CCM as well. The third item is protect brain health and dementia prevention. This is where the 2025 AHA and ACC guidelines explicitly recognize the link between midlife hypertension and late cognitive decline, including Alzheimer's disease and vascular dementia. Sustained high blood pressure, especially when untreated during the 5th and 6th decades of life, leads to structural changes in the cerebral small vessels. So this causes white matter hyperintensities, silent infarcts, microbleeds, all of which are a precursor to cognitive impairment. So the emerging evidence suggests that not just elevated BP, but blood pressure variability, those spikes up and downs, will cause neurovascular damage. So these new guidelines have a tighter BP control in midlife. So especially now looking at your systolic, we want it to be under that 130 mark for at-risk adults. So noting this may delay, even reduce the incidence of dementia down the years. So this early awareness and doing something earlier is more critical than ever. So there's a growing consensus that BP management post-stroke in patients with mild cognitive impairment or a family history of dementia should be a priority as part of that strategy, not just a cardiovascular one. And then lastly is going to be expand monitoring during pregnancy and postpartum. So high blood pressure in pregnancy and postpartum is a major risk factor for complications such as preeclampsia, stroke, and even long-term cardiovascular disease. So these new guidelines really call for an expanded monitoring during this time period, that we can identify those risks earlier and step in before it becomes a serious problem for mom or baby. So what does this mean to your practice, right? When we're looking at aligning better care from a clinical perspective, this is aligning with the new guidelines that gives a clear roadmap and expand on monitoring and making sure that the practices stay aligned with national standards. From an operational perspective, we look at how someone like us, PwC, manages monitoring, alerts, and documentation. We take the heavy lifting off of the practice. Our team handles the daily monitoring, they triage, they educate, they alert, and then they provide the full documentation so providers can focus on care. And we only provide our providers with actionable data. Thirdly is the financial reimbursement available. So over $120 plus per patient per month, there's a strong financial upside. And then lastly is more patients eligible for enrollment under that stage 1 umbrella. So this now included in the guidelines can help trigger more patients that we're able to help. All right, I'm going to pause here. I'm going to turn it over to our Director of Clinical Ops, Tina, to talk about the next couple of slides. Tina, take it away.
Thank you, Rob. Thank you. Okay, so according to the American Heart Association's latest research and guidelines, blood pressure isn't just about heart attacks and strokes. We now know it's also tied to something many fear much more, which is the dementia. So today I want to show and share how our protocols, patient education, and care coordination not only protect health and independence for patient, but also give providers and practices the tools and data they need to really make a difference. So, excuse me. First, we don't leave care to chance. Our protocols are designed with built-in alerts, timely notification, and provider EMR review. I apologize. And the provider EMR reviews. This ensures patients are not only monitored, but also guided to follow the provider's plan of care. For practice managers, it means their stronger performance on quality measures and less scrambling at the end of the year as they try to meet those measures. So we've learned that patient education must go beyond blood pressure numbers. When we explain to patients the connection between uncontrolled hypertension and dementia, patients suddenly understand the why. It's not just about preventing a stroke or heart attack. It's about preserving their memory, their independence, and their ability to live life to the fullest. For providers, an educated patient is more engaged and adherent to their plan of care, which leads to fewer preventable ER visits and admissions. So RPM allows patients to see their progress in real time. We teach patients about the American Heart Association's stages of hypertension so they know when it's urgent and when their blood pressure is in a safe range. But it's not just about the numbers. I can't say that enough. Care coordination is about relationships. We know that our patients don't care about what we have to say until they know we care about them. And sometimes caring means helping them access affordable medications or connecting them to food and utility assistance or arranging transportation. This means less time spent untangling social issues during practice visits and much more satisfied patients. Our reports are built on the newest American Heart Association standards. This alignment ensures patients and providers are working on the same evidence-based playbook. For providers, this creates confidence in decision-making and supports reimbursement. And finally, providers know what each individual patient's needs. Our role is to amplify that guidance, to really help the patient understand it, follow it, and benefit from it. When patients receive consistent messaging between us and the providers feel supported, and the practices have much stronger and better outcomes. So let's do a case review here real quick. So the American Heart Association's guidelines remind us what we once called mildly elevated blood pressure is no longer safe. And we're going to talk about Mrs. J. She's 58 years old and was recently diagnosed with essential hypertension. But we all know hypertension is also called the silent killer, and we don't know how long she's had it. Her Prevent Risk Calculator risk score from the American Heart Association showed something that most of us don't see, which is a significantly elevated 10 and 30-year risk. So through RPM, we identified not only a rising trend in her blood pressure, but also that she wasn't taking her medication correctly. That gave us the opportunity to provide education and explain why adherence mattered for her long-term health. And we encouraged her to schedule an appointment with her provider. And at that visit, the provider adjusted her medication and scheduled a follow-up visit for 2 weeks later to ensure the change was effective and sustainable. So what was the result? Her blood pressure is now within the American Heart Association's normal range. She's taking her medication as prescribed and following the provider's plan of care, and her long-term risk of the health threats associated with hypertension and loss of independence is being reduced. But I also want you to think about the ripple effect of this. If Mrs. J develops dementia, her independence is gone. It affects her adult children who should be at the beginning stages of retirement and spending time with their grandchildren. Instead, with a dementia diagnosis, they might be navigating her medications, doctor visits, daily caregiving, and then think about the financial aspect. Their lives would change too. But by acting early and with combined support of the provider and the RPM or CCM team, Mrs. J is taking steps to protect her independence, but also protecting the independence of her family and their ability to live a full life. So for the provider, research shows that dementia patients require longer visits, more medications, higher hospitalization rates, and more complex coordination. Early blood pressure control doesn't just change Mrs. J's story, it makes her care far more manageable for a provider. This is what the American Heart Association's new 2025 guidelines are really about. It's not just controlling the numbers, it's preserving quality of life for patients and families and for the providers who care for them. Rob, back to you.
All right, wonderful. Thank you so much for that case study. It really always helps to when you shed light on the use case on a real person like that. Really kind of sobering to think what dementia and the impact that has. So this slide is really just kind of next steps. So if you're a clinic, an administrator, a provider out there watching, what can you do next? How can you take what we've just talked about and put it into your practice? First thing is, are you doing an RPM or CCM program? If you are, you want to start taking a closer look at your patients that are in that stage 1 area and enroll them into an RPM program or CCM program. Secondly is, how can I utilize the prevent risk calculator? So internally, you can utilize it when you're seeing a patient during annual wellness visit, like I mentioned, or in an RPM program if you run an RPM program. In that scenario as well, when you're doing an intro call with the patient, one of your first few calls. And then thirdly here, schedule a consult to review your patient panel impact. Be happy to go over that with you guys, myself or Tina, both of us. We can sit down and look at your panel guideline and address areas where maybe a program like this can be helpful to your practice. So we're gonna pause here and see if there's any questions by the audience. Otherwise, we can start wrapping things up. And Gustav, I'll turn it over to you.
Yes, we have 2 questions. One of them being, can you talk about the best practices for using Prevent Calculator for RPM and CCM programs? Let's go with this, and then we'll go with the other question later on.
Yeah, so I think as I mentioned, the Prevent Calculator is a really great tool that can help set the talk track for as a provider. So one of the things I didn't mention, I am a registered nurse. I've been an RN for over 25 years. And been in this space, in the remote patient monitoring space, since about 2011. So any tools like this where we can utilize remotely, where we can utilize virtually, are very beneficial as to establish trust, to establish talking points with the patients. But on the flip side, there's also kind of considerations. Wouldn't you think, Tina, that you deal with patients more often these days? What are some of the things that come to mind when using a calculator like this and having a conversation with the patients about it?
Right. It's definitely about knowing the patient and how they would respond. And I think these conversations come best from providers. We don't want to scare the patients, but at the same time, they're often more willing to learn and listen when they understand that there are risks out there associated with high blood pressure. And if I knew that I could reduce my risk of a stroke, heart attack, and especially dementia, um, I, I think I would be more willing to listen and it would make me more adherent to my medication because we're talking about not just today, but that long-term quality of life.
Yeah. And so much of it is lifestyle as well that we can help guide and coach along the way.
Right. And I do think that those are natural discussions with our patients when we're talking to them about the health threats associated with hypertension. They love to say, what can I do that's not taking medication? We always let them know they have to follow their doctor's plan of care. But another way to help is to watch what they're eating, following a heart healthy diet, increasing exercise, and those kind of things, they're more willing to do when they understand it's only going to help them.
Yeah. Yeah. Thanks, Tina. Mustafa, do we have any other questions?
Yep, we have one more question, and that is, in light of the new hypertension guidelines, how can healthcare providers best leverage RPM reporting to support these guideline-driven care?
Well, this is one of my favorite. Yeah, this is a juicy one. Tina, do you want to take a stab at it first?
Rob, I'm going to let you. I'm sorry.
So much to
Thank you.
unpack. But
Yes.
yeah, so from a reporting perspective, it's a conversation that I have every day with our practices, our providers, and administrators, and it's hey, how can I use the data that you're capturing from these remote programs, RPM, CCM, and know who to target, when, how often, and for what. And in the reports that we're able to generate, especially now when we're looking at adding an earlier onset of hypertension, now we're able to align every one of those stages with things like your HEDIS scores. So if you're part of an ACO, if you're an affiliate, these are really good conversations to have with your ACO rep, identifying the patients that are at your highest risk, the ones that have that uncontrollable hypertension, and what are you doing for them? So now we have a program where we're addressing how they're taking their medications, how often, how adherent they are to the program, and we're getting data on a daily basis. Over time, we're able to identify the bulk of patients where we need to spend a little bit more coaching time and triaging time. And then we're also being able to identify those that are really doing good, that have turned that corner. And Tina can speak more on this. So many success stories that come out of programs like this. It's really, that's the heartwarming thing, is to see those success stories come to life. And when you start with a program, a practice that had a let's say a lot of patients that were outside of that HEDIS quality score, and now we've turned it up to where we're meeting 78, 80% HEDIS. It's really satisfying to see that. So I know we've coming up on time here, but those reportings are going to be the most important in today's value-based world. On the flip side, the other reporting that is also common is going to be kind of like our financial impact reports, which really outlines kind of all the billable services that programs like this can generate on a daily basis, or monthly basis rather. But from a clinical standpoint, that value-based piece, it's really an amazing tool to be able to risk stratify all these patients. Any other questions, Mustafa, before we wrap it up?
No, none in so far. So, thank you, Rob, and thank you, Tina, so much for sharing your valuable feedback today. And thank you, everyone who joined us today for this important discussion on how the new hypertension guidelines and their implications for RPM programs. Hope today's session gave you a practical takeaways on how these guidelines can be integrated into clinical workflows to improve these outcomes. If you'd like to learn more on proactive wellness care and how we support practices with RPM and CCM, please visit our website at www.prowellcare.com or reach us out at Facebook or LinkedIn. On behalf of our entire team, we appreciate your time and engagement. We look forward to connecting with you soon again. Thank you so much.